Have you ever wondered if hormone replacement therapy is right for you? In today's special episode, we're looking back on 3 of our most insightful conversations with our experts who break down everything you need to know about HRT. We'll debunk some common myths, explore who truly benefits from it, and discuss when it's time to look deeper at what's happening in your body before considering HRT. If you've ever felt confused by the mixed messages around hormone therapy, this episode is for you. Keep listening to the Menowave Lounge, hot flashes, and cool conversations as we revisit these vital discussions to empower your health journey. Welcome to the Menowave Lounge, hot flashes and cool conversations, where today we are revisiting some of our best episodes about HRT from our experts. Let's start by revisiting episode 22, where Dr. Dovile Calvinskata joined us to demystify hormone replacement therapy. In this conversation, she lays the groundwork, explaining what HRT is and who it can help, and she also clears up the common misconceptions that often cause unnecessary worry.
Why do we need HRT in our life? What are maybe some of the risks or the benefits of it?
I think probably just taking a step back, hormone replacement therapy. So what are we replacing? So with menopause, basically your ovaries stop working. You used all your eggs and stop producing the hormones such as estrogen, progesterone. I mean, there's still some of it left and produced by other tissues in the body to some extent, but we lose the majority of it when we use our all eggs. And it's not only estrogen and progesterone, there's also testosterone, another big hormone. We have more testosterone in our body than we have estrogen. Obviously, we have less than men, but it's still a very important female hormone, so to speak, that we need. And we lose these hormones when we hit the menopause completely. But not only that, the perimenopause, which is about 7 to 14 years leading up to menopause, is perimenopause, where these hormones fluctuate. Sometimes we have too much of those hormones, sometimes too little, but those changes sometimes are so chaotic. It's basically perimenopause is a zone of chaos, and menopause is like jumping off a cliff, losing those hormones. So hormone replacement therapy is basically trying to replace those hormones that we lose. It's estrogen, the progesterone, and testosterone. Hormone replacement therapy covers all of them. Then there is body identical and bioidentical HRT. That's sometimes also very confusing. So body identical HRT means that with these preparations, we get the same hormones that our body produced. It's just in the form of a patch or a gel, but we're getting the same hormones that we lost. They're not synthetic in any way. They look exactly the same like our body produced. So that's his body identical hormone. So it's estradiol and progesterone. There are synthetic hormones like conjugated equine estrogen or progestins, which are synthetic progesterone forms, which don't look exactly like our body makes it. So that would be sort of the conventional hormone replacement, part of the conventional hormone replacement therapy. But body identical is the same like our body produces. And then we have bioidentical. So the difference between body identical and bioidentical is essentially how are they regulated. So body identical hormones, they're approved by FDA, the dose is regulated, and the bioidentical compounded hormones, basically they're hormones, but they're not regulated, so we don't know what dose they have, and they're not licensed or checked. They don't have those safety checks. So when you're getting them, you don't really know what dose you're getting. So the safety is a bit off, and we don't have the same level of control like we have with body identical FDA approved preparations. So that's why I would always start with body identical HRT. Those are the most safe. They're the same like your body would produce. They have the best safety profile, best efficacy on the symptom control. Then the other HRT that is also approved and controlled with some synthetic progesterones, but the bioidentical one, there are some FDA approved forms which can be used, but most of them bioidentical compounded are not approved. So that's why they're not as safe, not well controlled. And I wouldn't go there necessarily, since we have very safe, very effective body identical FDA approved options.
When should a lady start?
Yeah, so the HRT obviously approved indications is to help control menopause symptoms. Some people now actually discuss whether we should start HRT as a preventative care for long-term health to protect bones, heart, brain. And so there's a debate on that, which I probably would agree to some extent. Obviously, HRT is not for everyone, but we can start as early as in perimenopause, when your symptoms start, and if they're not well controlled with other measures like lifestyle changes and other things that we can do, then we start the HRT. Even if you still have periods, we can start the HRT very early on in perimenopause. The best time to start HRT is in perimenopause and up to 10 years after menopause. So that's sort of the safest window, we think, because it gives you the best. So take it like this. So estrogen is best to prevent, not to treat. So if you already have heart disease, let's say you're very late in your 60s or 70s, it's not going to give the same benefits, let's say, as prevention. So the safest and the most beneficial, effective way to start it is as early as possible. So either perimenopause or first 10 years of menopause. It's not to say that you cannot start later on, but we have to assess risk factors, risk versus benefits when we start later on. So there's a bit more that we have to look into. So we definitely can start at any stage if we need to, but the safest is as early as possible.
So you said could be used for postmenopausal women as well?
Yeah. So the terminology. So perimenopause, like I said, the years leading up to menopause can be 10 years, sometimes even more to menopause. Menopause is the day when you have no periods for 12 months. That's the day of that. Postmenopause is everything after that one day. So that's the rest of your life. So
Right.
first 10 years of that is sort of considered the most safe window to start. Then first of all, we don't have much data. Like if you looked at the evidence and the research, we have millions and millions, research done on pregnancy and fertility. And just a fraction of that, probably 0.03% of that, like on menopause. Like we don't know a lot. But what we know that if you started later, so 10 years later, we don't have the same benefits for reducing the risk for cardiac disease. There are even studies showing that for some women, it might make the dementia symptoms worse or dementia progress more if we started too late. There's conflicting evidence on dementia in general, but we have to take those studies into consideration. I'm not saying it's necessarily going to do that, but there are some evidence to suggest. So we have to be careful. And we also, with age, we acquire other medical conditions, more medications, other risk factors, the weight gain and all that, so which all compounds and adds to risks. So we have to evaluate all of that before making that decision whether HRT is still beneficial or is there more risks associated with it. So it's a more careful assessment, but we still sometimes start. And if your symptoms, you're struggling so much with your symptoms, you're not able to sleep, your life quality is affected, and you're just not able to live without it. It's at the end of the day, it's women's choice.
Mind sharing with us some of the more common myths around HRT?
So I think one of the most common I hear is that you cannot start HRT in perimenopause while you still have periods. So that's definitely not true. I mean, initially when HRT was approved, it was licensed for use for women in postmenopause, but that's not true anymore in any way. If you have symptoms, then we start it as early as possible. About the risk of, HRT will cause you breast cancer. I think that's the most common one, probably, isn't it? So yeah, I don't even know where to start. So the CHI study that was in 2002, I think, created so many misinformation, fear mongering, and it was so there were mistakes in the study itself. There was misinformation, misinterpretation of data, which caused huge havoc in what happened afterwards. And what that study showed, that there was a relative increased risk of breast cancer by 20%. So we have to understand relative risk and absolute risk. So absolute risk is how many actual women had breast cancer. So there was one extra case per 1,000 women. But that one extra case meant 20% of relative risk, which sounded very scary. And it was old type of HRT, synthetic one. And also it was used in the wrong population. So it was like lots of problems with that study. But it created this fear around, oh, it causes cancer. However, in the same study, the other group in the same study that were only on estrogen actually showed reduction in breast cancer by 20%. So the only people who had like that slight increase were the women who were on estrogen and the synthetic progesterone. And the ones that were only on estrogen actually reduced risk of breast cancer. So, what are we talking about? And women are not just their breasts.
Right.
So that's one thing we have to discuss.
That.
Yeah.
I love debunking that theory.
Yeah.
They are not just our breast.
Yeah, women are not just breasts. We have to think about bones, heart, brain, mental health, metabolic health. There's so many more things that HRT does. And so it reduces risk of heart disease by 30%, reduces risk of diabetes, reduces risk of osteoporosis. And, 50% of women in postmenopause will have osteoporotic fracture, which is mostly preventable. And most of those women die within 1 year, if not done anything. Like 70% will die within 1 year. So, and mental health, depression, anxiety increases so significantly with menopause. And we know that HRT is actually #1 gold standard treatment for that. It's not antidepressants, and it's a lot more effective. So we have to take into consideration all of that. And for example, suicidal thoughts are 8 times more common in postmenopause. Anxiety 2-3 times more common. So, and these are things that affect people's life quality and lifespan even. So we have to weigh those benefits and risks and talk about everything, not just breast. Obviously, so estrogen, just to say, estrogen itself does not cause breast cancer, but if you have abnormal cells, it might make it grow faster. So definitely we want to check breasts, yearly mammograms, those kind of things. So it's important to do a health check before we start to assess all those risks. So that's #1. The thing is, we know that if you get breast cancer while you're on HRT, the breast cancer is diagnosed earlier and women die less because we catch it earlier. And so mortality also is reduced if compared, you get breast cancer but you're not on HRT. So estrogen is also anti-inflammatory, so reduces overall inflammation in the body, it improves your metabolic health and everything else. So it improves your health overall. So we have to weigh all of that before deciding whether it's HRT is for us or not. Obviously, if you had cancer in the past, breast cancer or other sort of hormone active cancer, we definitely wouldn't take that lightly. It's official, one of the main contraindications for HRT, and we want to involve oncologists and all that. And most often we would try everything else. But even in those cases, in certain scenarios, if nothing helped and the life is miserable, we do have once in a while women who had breast cancer and still on HRT because life is so miserable that she doesn't even want to live that life if those symptoms are not addressed and nothing else worked. So not to say that everyone who had breast cancer now has to go on HRT, definitely not, but just saying that it has to be conversation, assessing all the risks, benefits, involving all the specialties if needed. And if someone who has, let's say, increased risk of breast cancer because of family history or genetics and all that within the first 4 to 7 years, depending on the HRT form, does not additionally increase that risk. So it's still safe for those women to try. Obviously, they already have increased risk, but HRT does not additionally increase that risk.
Next, we dive into episode 36, where Dr. Glenn Debunking shared his perspective on why hormone replacement therapy isn't necessarily the first place to start when seeking symptom relief. He offers alternative approaches and explains why understanding the root cause of our symptoms is key before considering HRT.
The female body is designed to simply transition from childbearing years into perimenopause, into menopause, and postmenopausal with, at most, as I said, that speed bump in the road, right? But here's the thing, though, is this is dependent on you having a healthy, I'll just say adrenals to make it a little bit simpler, but it's not just adrenals. It's really how your brain, your hypothalamus, your pituitary, and your adrenals are working synergistically together. When that system is working well and you have vitality in that system, because the simple fact is that when you're going from childbearing years into perimenopause, you're now lowering the production, like naturally, your ovaries are not doing what they did when in childbearing years. You're no longer producing the amount of estrogens and progesterone in the ovaries. Now there comes a higher need for the body to produce this because of that HPA axis, the hypothalamus, pituitary, and adrenal. And the big problem, though, is that by the time women have entered menopause, so let's just say, we'll just use the 50 years old as an example. So by the time a woman actually is 50, and what's happened is now she's already been living with these infections in the gut. The infections have probably driven the inflammatory response. All of this is really blowing out and reducing vitality in that system. So now when a woman enters menopause, the vitality is it's not gone, but it's significantly diminished to the point where you can't transition optimally. So now you can't produce what you should be producing in the adrenals or in this HPA axis, and you're left high and dry. And like one of the most common symptoms I see all the time is weight gain. And it's almost expected now that once you get into menopause, you should gain 20, 25, maybe 30 pounds or more for some women. And here's the simple reason why is because if your body has been used to producing estrogen in your ovaries for all these years and decades, literally, and now the ovaries are no longer doing that, and the adrenals can't because they lack vitality because they've been blown out for these health reasons and then other reasons that we'll probably talk about a little bit later about how a woman's life is different than a man's, is then what happens is the vitality isn't there. So now the estrogens don't get produced. And one of the best places to produce estrogen, if you can't produce it naturally in your hormonal system, is from fat cells, adipose tissue, which is fat. So what happens is women gain fat to be able to maintain somewhat of a estrogen balance. And even just the fat itself doesn't maintain the full balance. So not only are you gaining weight to that adipose tissue, which is fat, to help with estrogen production, it's still not giving you an optimal production. So therefore, not only did you gain 20 plus pounds, you're still not feeling optimal because you can't produce everything you need. You still have the dependency on those adrenals and that HPA axis to do this. And for most women, by the time you reach menopausal years, and I'll even say that's really the 75 to 85% statistic. There's that 15 to 25% who go through exactly what I'm describing, but they're not the ones out there talking about it. They're just like sending out prayers of gratitude of, thankfully, I'm not one of those women who's suffering like that.
Well, that's really interesting. And so the body is producing fat in order to get enough estrogen because your adrenalines and your ovaries are not producing the estrogen. So are there natural ways of being able to put that estrogen back in? Or is this like an example of, getting a BHRT to balance that out?
Yes, absolutely. And this is another place where I'm different too. I've been working specifically with women for 19 and a half years with menopause. And in 19 and a half years, I've only recommended estrogen 5 times and progesterone like 7 or 8, only in the most extreme cases. And because the whole thing, and it's kind of the trap for women too, is that, if let's just say hypothetically, a woman is tested and her estrogen is low. So, and usually they'll recommend estrogen and also progesterone together, and then they feel better, right? Because it was low, except though that's still not fixing the problem. It's fixing the symptom. So when the problem is really twofold, it's kind of number one is how the brain, the hypothalamus, pituitary, and adrenals aren't working properly. But then even before that, it's the triggers of why that isn't working properly, right? So the trap is that for some women, taking estrogen and progesterone is symptom relief. So they feel better, except they're still not fixing the problem. So there's still triggers. There's still this hormone imbalance that's affecting the body holistically. And other problems come up that are not necessarily tied into menopause. but it could be the severe gut issues. It could be the severe pain of inflammatory conditions. It could be the severe issues with the brain and basically neurological degenerative kind of issues. When we think of like hormones production, it's hormones are really all about conversions. It's your body just doesn't randomly only produce X, Y, and Z. That's a lot of conversions from a hormone perspective. And estrogens are like at the end of the line as far as conversions are concerned. So rather than work at the end of the line on a symptom care, I like to work at the core or the foundation of where it's going wrong, which is the triggers and the whole aspect of how do we kind of like help the body naturally re-engage this HPA axis. And so it's just it's a whole different approach, yet as I've seen for almost 2 decades, it's an approach that works. There's so many times where I've even heard women say that, well, I've already been doing all those things, but sometimes it's the things that you don't even think about, like this, as I brought up the example, this one woman, she eats eggs at least 5 times a week, and she doesn't know she has a significant sensitivity to it, which is driving an inflammatory response, which is affecting her hormonal system. Or she would have never known she had SIBO, which is driving another significant challenge. And these are the problems that women kind of get stuck in. And while I don't use, I typically don't use estrogens and progesterone. Sometimes women will ask, well, what you do, I'm already using estrogen and progesterone. Do I need to stop? It's like, no, you could still keep using a symptom care while we work on getting to the bottom of what's going on. So hopefully there becomes a time where you don't even need the symptom care. That's what I want every woman to be back into a natural hormone balance without taking anything is what I'm always looking for, like longer term.
This is fascinating because it seems like then when we start noticing these symptoms, whatever they are, that's a message from our body of like, oh no, we have hit that this house of cards is falling now. And so the HRT helps relieve the feeling of the symptoms, but it's almost like slapping a Band-Aid on it. That is really needs to be our cue to go, okay, let's figure out what's under the surface here.
If you can't do the simple things, you can't expect the bigger things to find balance there, right? Think of it this way. This is a good analogy for the men listening too. If you're building a house, you don't start by, oh, well, let's put together the studs for the walls and put those up. You don't start building a house out with that way. You build a foundation first, then you build the floor, then you build the walls, then you build the ceiling, then you build the roof, right? So the foundation of this is always your fundamentals, right? And then the floor, the next step is then really understanding comprehensively what's going on hormonally speaking. And literally, I can look at 10 different hormone results in one day and see 10 complete different expressions of what's going on hormonally. Like sometimes I see women with low estrogen. Sometimes I see women who they're improperly converting testosterone into estrogen. So now their testosterone is depleted and now they have an estrogen dominance, which is a risk factor for breast cancer. I can see like significant inflammatory triggers. I can see that maybe the part of the phase 1 liver detoxification pathway isn't allowing proper metabolism of estrogens. Like there's all these different combination of things that could be like imbalance in your hormones. So that's kind of the floor. You want to look at that. You want to know it comprehensively. You want to be able to see not only what's in your blood, but what's in the body. And then you can start making recommendations. You set up some balance there, right? But then the walls that we're talking about, then you have to look at, well, what are the different triggers? Is this food sensitivity? Is it gut infections? Is it other infections in the body? Is it toxicity? Is it chronic inflammation? The list goes on of what that can really be. And generally from there, you've got your answers. Generally from there, you're beginning to feel better. You're starting to notice that symptoms are dissipating.
Finally, we wrap up with episode 38, where Vanessa Weiland brought her expertise on perimenopause and HRT myths to the table. Vanessa goes beyond the basics, offering holistic health tips and helping us to understand when it might be time to consider alternatives or deeper health evaluations before turning to hormone therapy.
One of the questions that we see a lot in the menopause support Facebook group is, what is HRT or BHRT, and when should I started. Should I get on it? Should I not get on it? Some women have had bad experiences with it, maybe because they weren't diagnosed correctly or they didn't have the right combination of therapy. What are your thoughts about that, especially in the perimenopause arena?
Yeah, I mean, there's a couple of things to think about. First of all, it isn't always menopause, especially if it's someone like me coming in with abnormal periods and sudden issues with anxiety and trouble sleeping. We should think about the thyroid or anemia. There are other things we should be thinking about. We don't want to go the other direction and say everything is menopause. But a lot of providers, since they're not super comfortable with menopause hormone therapy or HRT, will either say, we can't do anything until you're in menopause, which is not true. Or they'll say, maybe your hormones are off, let's give oral contraceptives. And for a lot of women, actually, that does the trick, because the oral contraceptives is a much higher than normal level of estrogen. It's a synthetic estrogen. So it kind of steadies everything just because it's extremely high dose. But as I'm sure you've both heard, a lot of women don't like how they feel on that extremely high dose. So it's not the same thing. But on the flip side, menopause hormone therapy or HRT isn't a contraceptive. So if having a baby is totally off the table for you, then you still need another option on top of that to protect you from getting pregnant. The birth control pill is giving you such extreme high level of estrogen and progestin that it's shutting your whole cycle down. It's disrupting your natural process in your body that would turn on ovulation, make an egg come out. So for some women, they're just fine, and it's covering their hot flashes because it is estrogen replacement. But a lot of people don't like those super high levels. They feel crabby or moody or whatever else. They just don't feel good. So HRT, or menopause hormone therapy, is really just designed to be a little bump back into kind of a normal range for a 20-something or 30-something. So that's why it doesn't protect you from pregnancy, but usually you're not going to have some of those.
There are a lot of women who, for a variety of reasons, and as we know from talking to some of the other practitioners, it's probably because they have good gut bacteria, they have a healthy lifestyle, but they don't have any negative symptoms of menopause. They don't have the hot flashes, anxiety, any of that. Do they need to go on HRT, or are they okay just staying natural and taking it as life comes? Because then there's a lot of argument on the other side of like, well, it protects your heart, it protects your brain function. So I can see a lot of women are like confused. They're like, well, why would I want to go on it? But I also want to protect myself.
Yeah, obviously you don't need to go on it, and none of the medical guidelines say everyone should be on this for prevention. We're not there yet. I think there's been a big movement lately talking about all those preventative aspects, and I think it's good because a lot of us have been thinking that HRT is bad for us for 20 years. So we're moving the dial back in a more neutral direction, but maybe almost too far where people start to feel bad if they're not on it, where really the science isn't quite there yet to say that we ought to do it for everybody. The one exception where we know that it's FDA approved for prevention is actually for bone loss. So if you're someone who has been slender your whole life, you have osteoporosis in your family, some other risk factor for osteoporosis, that's one time where hormone replacement is FDA approved as a prevention. But we're not there yet as far as heart health and brain health. I think the science there is really exciting, and I do think that there's quite a lot of data to support that. But I also would never tell someone that you have to be on hormone therapy if you feel like you don't want to. And none of the guidelines say that you ought to do that either. I've seen a lot of women in the menopause support group that say, oh, I tried HRT for 2 weeks and it gave me these symptoms and I just gave up. But there's so many things that we can do to adjust to try to find the happy medium where you don't have symptoms and you also have your menopause symptoms treated. And there's something you said, Robin, that I wanted to address quickly about the BHRT and having something compounded. And I think there's a lot of ethical and safe compounding pharmacies, but I just want to call out that you can get bioidentical hormone therapy, FDA approved patches or pills. So it doesn't have to be the compounded. And generally speaking, it's recommended to do the FDA approved ones just because they have a much more stringent process to get the FDA approval, and you can be more confident that batch to batch, you're going to get the same levels of everything. That's the main complaint I get for people that have tried compounding, is maybe it's great 1 month and the next month it's not working well, or it's working too well. They're having symptoms of too high of estrogen or testosterone. So I think for a lot of people, they can only find providers that offer compounding or pellets. And so, I recognize that there's kind of a vacuum of access out there, and maybe that's all you can get. But I just want to say, generally speaking, if you can find someone that will offer the FDA approved options, that's considered the safest place to start.
What are some of the truths that you found that our audience would be interested to hear that they may not have heard before?
Well, I mean, here's the biggest truth that most people don't know, and most women don't know. And it got, even statistically, like there's 2 million women enter menopause every year in the US. Now, that doesn't even include the women who are already in menopause, right? And about 75 to 85% of those women are suffering with significant symptoms. The symptoms that all of you know about, the weight gain, the sleeplessness, the night sweats, the brain fog, just the list goes on. And the truth, though, is that those are not symptoms of menopause. There's only two true symptoms of menopause. And after working with women for all these years, most women are pretty excited about the 2 true symptoms, because the only 2 true symptoms of menopause are that you no longer have a monthly cycle and you can't conceive. And most women at about 50 would celebrate that. And all these other symptoms that women are dealing with that I mentioned, the weight gain, the sleeplessness, the hot flashes, the mood swings, the fatigue, all of that, those are symptoms of other underlying hormone conditions that also have triggers that could all be understood. But women have basically been told, most of your lives, you've been told that these are the things you should expect. And to me, this is the thing that I can't say loud enough or get to a place where I can say it to enough people, is no, you should expect to literally go through a hormonal transition to where you no longer have a monthly cycle, you can't conceive, and it's literally like hitting a speed bump in the road. It's like boom, boom, and then you just go on. And that's how it should be for women.
Well, that's really interesting that you said. I just kind of want to like slow this down for a second, because you said that really the 2 true symptoms are no cycle and not being able to produce babies, but everything else is hormone driven or hormone symptoms. And so by understanding that, then, and learning how to balance the hormones, then that can alleviate a lot of the problems that we go through that we call menopause. Is that what I'm hearing you say?
Yeah, that's a part of it. And it is important to really comprehensively know what's going on with your hormonal system, which is a whole nother issue, because most of the time when you go to the doctor and they run a blood test, they might be looking at generally progesterone, estrogen, and maybe testosterone is usually what's looked at. And it's usually just the estrogen and progesterone. And they're looking at blood. Well, blood only shows you what's in the blood in that moment, right? It doesn't show you anything that's potentially built up in the body. So and it's not really comprehensive enough. Like literally when I'm looking at hormones, number one, I'm not looking at blood because it really doesn't give you the answer, like the holistic answer of hormones in your body. I'm always looking at a 24-hour urine collection, and I'm literally looking at 32 different hormones, how your kidneys are affecting this, how 2 different parts of your liver are affecting, like estrogen metabolism, as an example, how the chronic inflammation is driving this, and chronic disease states are driving it. So you want to be able to look at everything. And here's the other thing that is the key understanding, is that what is wrong hormonally is not a hormone problem. This is like a little golden nugget. The problem is whatever is triggering the hormone response. And so really overcoming the symptoms that you're dealing with today, it's not just understanding what's going on hormonally and working on balancing that. You've got to understand what are the triggers. Is it chronic inflammation? Is it infections in the gut? Is it food sensitivity that you're unaware of? Is it toxicity that you're unaware of? Is it all the mental emotional stress that is like, pushing you off the rail. Like there's just so many different levels to look at and understand. So yes, it's the combination of that. It's yes, you do want to look at the hormones, you want to know where you're at, you want to work on balancing that. And you really absolutely need to understand what's triggering the hormone response, because it's almost never a hormone problem.
Thanks so much for tuning in today. If you want to hear more from the guests we spotlighted today, you can listen to their full episodes out on YouTube, Spotify, Amazon Music, or Apple Podcasts. There's so much more insight and wisdom there from our Menowave care providers in these and other episodes. Just follow us on Facebook or subscribe wherever you get your podcasts. Remember, you're not alone in your menopause journey. We're here to support you every step of the way. Thank you for listening to the Menowave Lounge, Hot Flashes and Cool Conversations. Thank you for joining us in the Menowave Lounge. If you'd like to connect with Marty, Robin, our guests, or any of our expert Menowave care providers for personalized advice and support, head on over to our website at menowave.org and fill out an assessment that will match you with a provider who knows just how to help. Remember, you don't have to face menopause alone. Our team is here to provide the guidance and care you deserve. So, take that step towards reclaiming your well-being and connect with a Menowave care provider today. Thank you again for tuning in, and we'll catch you on the next episode of the Menowave Lounge, Hot Flashes and Cool Conversations.